Welcome back to Therapies. I'm Joe B. Today we'll go over the 3 best joint and muscle mobilization techniques to improve knee flexion post-knee replacement. Let's dive in. After knee joint replacement, most of the time, the patient will have limitation of motion towards knee flexion. The post-operative swelling can disrupt the screw-hole mechanics where the tibia glides posteriorly and internally rotates, while the opposite motion occurs at the femur. The patella glides inferiorly, which can also be disrupted and reduced. To confirm the presence of knee flexion limitation during assessment, the goniometric measurements will be less than 130 to 135 degrees of flexion, sometimes even less than 102 degrees of knee functional range. There will also be limitation of motion of knee flexion during the swing phase of gait. To improve knee bending, a combination of manual joint and soft tissue techniques can significantly improve knee flexion motion. Less is more in doing mobilizations after knee joint replacement to reduce the recurrence of swelling and further reduction of flexion. Start with the largest joint or the tibiofemoral joint, since it can improve joint mobilization of the smaller joints like the patellofemoral joint. That said, the first technique will be the tibial posterior glide. The position of the patient will be in supine with the therapist on the treated side. The left hand will be at the heel and the right hand will be just below the tibial tuberosity. From there, the knee is flexed with the assistance of the left hand up to patient-tolerated end range. Once that is reached, the left and right hand will distract the joint by pulling it down towards the table, and from there, the therapist will deliver a tibial posterior glide up to the limit of the range, which is grade 3 or grade 4. Each glide is held for 3 reps for 30 seconds each. Then you can move on to the patellofemoral joint. The position of the patient is in supine with the therapist on the treated side. The left hand will be at the heel and the right hand lateral forefinger pads will be at the base of the patella. From there, the knee is flexed with the assistance of the left hand up to patient-tolerated end range. Once that is reached, the right lateral forefinger pads will deliver an inferior patellar glide up to the limit of the range, grade 3 to grade 4. The position is held for 3 reps for 30 seconds. For reducing muscle tension that can restrict knee flexion, a quadriceps muscle release can be done with the patient in supine or, if tolerated, with the treated leg dangling off the side of the table. The therapist will be on the treated side with the ulnar border of the left hand performing 15 to 30 slow strokes from just above the patellar base to the proximal third of the thigh. The right hand can stabilize the leg. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therapies.